We're learning more and more about how important vitamin D is for our health. This essential nutrient plays a crucial role in various bodily functions, from maintaining healthy bones to supporting our immune system. But its benefits don't stop there. It's often called the sunshine vitamin because our bodies make it when our skin is exposed to sunlight. Just spending a little time outdoors can help boost your vitamin D levels, which is why it's so important to get outside whenever you can. But did you know that vitamin D might also play a role in our mental well-being, especially when it comes to depression? Emerging research suggests that there could be a significant link between vitamin D levels and our mood. This means that getting enough of this vitamin might not only be good for your physical health but also for your mental health. Depression is a complex condition that affects millions of people worldwide. It can manifest in various ways, including feelings of sadness, loss of interest in activities, and even physical symptoms like fatigue. Understanding the factors that contribute to depression is crucial for developing effective treatments. While there are many factors that can contribute to depression, research is starting to explore the potential link between vitamin D levels and our mood. Some studies have found that people with low levels of vitamin D are more likely to experience symptoms of depression. This has led scientists to investigate whether increasing vitamin D intake could help alleviate these symptoms. This connection is fascinating, and it's important to understand what the science says. While more research is needed to fully understand the relationship between vitamin D and depression, the existing evidence is promising. It suggests that maintaining adequate vitamin D levels could be a simple yet effective way to support mental health. This video will explore the relationship between vitamin D and depression, looking at both the potential benefits and risks. We'll delve into the latest scientific findings and discuss how you can incorporate more vitamin D into your daily routine. We'll also provide practical tips on how to safely maintain healthy vitamin D levels. Whether it's through diet, supplements, or spending time in the sun, there are many ways to ensure you're getting enough of this vital nutrient. By understanding the importance of vitamin D, you can take proactive steps to support both your physical and mental well-being. For years, we've known that vitamin D is crucial for building and maintaining strong bones. It's a well-established fact that without sufficient vitamin D, our bones can become brittle and weak, leading to conditions like osteoporosis. This is because vitamin D helps our bodies absorb calcium, which is essential for bone health. Calcium is a vital mineral that our bones need to stay strong and dense. Without vitamin D, our bodies would struggle to absorb calcium efficiently, no matter how much we consume through our diet. However, scientists have discovered that vitamin D receptors are present throughout the body, including in the brain. This discovery has opened up new avenues of research, revealing that vitamin D might play a much broader role in our overall health than previously thought. This suggests that vitamin D's role extends far beyond bone health, potentially influencing various bodily functions, including brain function and mood regulation. For instance, vitamin D is believed to help regulate the production of neurotransmitters, which are chemicals that transmit signals in the brain and affect our mood and cognitive functions. When we don't get enough vitamin D, it can lead to a condition called vitamin D deficiency. This deficiency is more common than many people realize, especially in regions with limited sunlight exposure, as our bodies produce vitamin D when our skin is exposed to sunlight. This deficiency can manifest in different ways, including fatigue, muscle weakness, and bone pain. These symptoms can often be mistaken for other health issues, making it important to consider vitamin D levels when diagnosing and treating these conditions. Emerging research suggests that vitamin D deficiency may also be linked to an increased risk of mental health issues, such as depression. Studies have shown that individuals with low levels of vitamin D are more likely to experience symptoms of depression and anxiety, highlighting the importance of maintaining adequate vitamin D levels for both physical and mental well-being. The brain is a complex organ, and its proper functioning relies on a delicate balance of various nutrients and hormones. This intricate network ensures that our thoughts, emotions, and bodily functions are seamlessly coordinated. Any disruption in this balance can lead to significant health issues, both mental and physical. Vitamin D appears to play a role in this intricate system. Often referred to as the sunshine vitamin, it is synthesized in our skin in response to sunlight. Besides its well-known role in bone health, vitamin D is now being recognized for its potential impact on brain health. While the exact mechanisms are still being studied, research suggests that vitamin D might influence the production and function of certain neurotransmitters in the brain, including serotonin and dopamine. These neurotransmitters are essential for communication between brain cells and play a pivotal role in maintaining mental health. These neurotransmitters are chemical messengers that play a crucial role in regulating mood, emotions, sleep, and appetite. Serotonin, often dubbed the feel-good neurotransmitter, helps stabilize our mood and feelings of well-being. Dopamine, on the other hand, is associated with pleasure and reward mechanisms in the brain. Imbalances in these neurotransmitters have been linked to depression and other mood disorders. Low levels of serotonin and dopamine can lead to feelings of sadness, anxiety, and a lack of motivation. This is why maintaining adequate levels of vitamin D might be crucial for mental health. By potentially influencing the levels and activity of these neurotransmitters, vitamin D might indirectly impact mood and contribute to a sense of well-being. Regular exposure to sunlight, a balanced diet, and possibly supplementation can help maintain optimal vitamin D levels, supporting both physical and mental health. So next time you step out into the sun, remember that you might be doing your brain a favor too. Several studies have investigated the potential link between vitamin D and depression. Some of these studies have shown promising results, suggesting that vitamin D supplementation might help alleviate depressive symptoms in individuals with vitamin D deficiency. For example, one study found that people with depression who received vitamin D supplements experienced a greater improvement in their symptoms compared to those who received a placebo. Another study observed that low vitamin D levels were associated with an increased risk of developing depression over time. These findings indicate that maintaining adequate vitamin D levels might be important for protecting against depression. Too much sunshine, vitamin D risks. While vitamin D offers numerous health benefits, it's also possible to have too much of a good thing. Excessive vitamin D intake, usually through high-dose supplements rather than sunlight or diet, can lead to a condition called vitamin D toxicity. Vitamin D toxicity is rare but serious. It can cause a buildup of calcium in the blood, resulting in symptoms such as nausea, vomiting, weakness, and frequent urination. It's important to note that vitamin D toxicity typically occurs from prolonged use of high-dose supplements, not from sun exposure or food. Vitamin D and depression. What the science says. The current research on vitamin D and depression is promising but not conclusive. While some studies suggest a positive link between vitamin D supplementation and improved mood in individuals with vitamin D deficiency, more research is needed to confirm these findings and determine optimal dosages and treatment durations. It's crucial to remember that vitamin D is not a cure-all for depression. Depression is a complex condition with various contributing factors, and treatment often involves a multifaceted approach, including therapy, lifestyle changes, and medication in some cases. The future of vitamin D research. The field of vitamin D research is constantly evolving. Scientists are working to understand the complex mechanisms by which vitamin D interacts with the brain and influences mood. Future research will likely focus on identifying individuals who might benefit most from vitamin D supplementation for depression, determining optimal dosages, and exploring the long-term effects of vitamin D on mental health. As our understanding of vitamin D's role in mental well-being grows, we can develop more targeted and effective strategies for preventing and treating depression. How to safely get your daily dose of vitamin D. Maintaining adequate vitamin D levels is essential for overall health, including bone health and potentially mental well-being. There are several ways to safely increase your vitamin D levels. Exposing your skin to sunlight is a natural way to boost vitamin D production. However, it's important to do so safely and avoid sunburn. Include vitamin D-rich foods in your diet, such as fatty fish like salmon, tuna, and mackerel, egg yolks, and fortified foods like milk and cereals. If you're concerned about your vitamin D levels, talk to your doctor about whether supplementation is right for you. Recognizing the symptoms of vitamin D deficiency. Vitamin D deficiency is common, often with subtle symptoms that are easy to miss. It's important to be aware of the potential signs of vitamin D deficiency, which can include some of the things we previously discussed. If you suspect you might have a vitamin D deficiency, consult your doctor for a blood test to measure your levels. Vitamin D, a piece of the mental wellness puzzle. Vitamin D is a fascinating nutrient that plays a vital role in various aspects of our health, including bone health, immune function, and potentially mental well-being. While more research is needed to fully understand the relationship between vitamin D and depression, maintaining adequate vitamin D levels is generally beneficial for overall health. Remember to discuss your vitamin D levels with your doctor, especially if you have concerns about deficiency or are considering supplementation. Stay informed, stay healthy. Thank you for taking the time to learn about the intriguing connection between vitamin D and depression. We encourage you to stay informed about the latest developments in health research and to prioritize your well-being. Remember to like this video if you found it informative, subscribe to our channel for more health insights, and share this information with your friends and family. Your health is your most valuable asset, and knowledge is a powerful tool for protecting it.